According to our neck surgeon, a rhinoplasty or nose job can be one of the most complex procedures in plastic surgery, but if done properly, it can be one of the most rewarding procedures for the patient. Let's take a look.
I came in and loved him instantly and felt comfortable, and so that's who I chose to go with.
Patient Heidi Moulton is talking about Dr. Rohrich with the Dallas Plastic Surgery Institute. She went to Dr. Rohrich for a rhinoplasty, otherwise known as a nose job. Surgeons who perform rhinoplasties must have a passion to do them with great precision because it's a surgery of millimeters. Dr. Rohrich says that even small changes can make a big difference in a patient.
It really requires a lot of preoperative planning and analysis, and I think the most important thing in rhinoplasty is that you really have to accurately diagnose what the patient's problem is before surgery. So you have to have the roadmap so that in the operating room you can follow that roadmap and be able to actually maybe deviate it if there's a detour in the operating room. So the best way to do that is actually to have a good way to look at it, or intraoperative GPSs, so you can actually open the nose. It's a small little incision on the bottom of the nose, and you open and you actually can see what you're doing, and you can then restore to normal the area that's deviated and reshape the nose using the patient's own tissue. And I think that's the beauty of an open rhinoplasty. A modern rhinoplasty is again one that has actually got a natural, youthful look, not the scooped out nose and the pointed tip that we see so often.
He basically took my face and gave me exactly what I wanted without changing the look of my face. And Dr. Rohrich is really, really awesome at that because he doesn't make a different face. He just works with what you've got and takes it and makes it you.
Dr. Rohrich uses a general anesthetic during the operation and says that most patients can go home on the same day of surgery. For patients like Heidi Moulton, a rhinoplasty can be a life-changing event.
Now that I've had the surgery, you know, when I look in the mirror, I just see my entire face, not one thing sticks out. It's kind of the way I feel like it always should have been.
I have been nothing but pleased. Dr. Rohrich has been absolutely amazing.
I told him I want to have a healthy, functionally sound nose and just make it fit my face.
Heidi had a very, very long nose, and it was asymmetric and deviated, and she had also some breathing problems. We reshaped the top of her nose, brought her tip back, refined it. The inside of her nose, we also improved her breathing by straightening the inside of her septum. And that's where form and function meet, because you can improve the function by doing the inside of the nose, and then the form on the outside where you shape the nose.
Oh, I definitely recommend Dr. Rohrich. In fact, I've already recommended him to a few friends that have come in for consultations.
He's not going to give me a different nose. He was going to give me my nose, but refined.